Hi, my name's Marilyn. I'm a patient of Dr. Sachs and Dr. Schneider at Silver Lining Breast Reconstruction Center. I have a history of breast cancer in my family. I wound up testing positive for the BRCA2 gene, and it became something that I had to worry about. The BRCA gene was explained to me that I had a really high risk of breast cancer, especially with my father's sister and mother having the gene, and both dying around age 40, and I had just turned 40. I had something like an 80+% chance of breast cancer. My dad was diagnosed with cancer in July of 2022, so the next 6 months were really up and down. One minute it was really positive and he was responding to chemotherapy, but the next minute it was like, we don't really know. And then within a few weeks after that, we were told that my father wasn't going to make it, that the cancer had spread to his spine. By the end of April, he was gone. So in the weeks before my father died, I was thinking that I had to do something right away. It was pretty clear that breast was the thing that I really had to be concerned about. The first surgeon I met with, I felt very business. It was all business. And he said that the best surgery for me would be to essentially take my back muscles and move them along the side to create the new breast tissue. So I had a surgery scheduled for May, and then but my father had passed just a week before, so I canceled and was sort of grappling with the thought of having to schedule it a month later. And while I was dealing with that, a family friend of mine introduced me to Dr. Sachs. He's a breast surgical oncologist. I was interested in talking to him about, what he thought of the surgery and just to know what to expect. He was just immediately urgently almost wanting to put me in touch with Dr. Schneider. He was like, no way, we can't do that. You can't take your back muscles. He's like, you can't take your back muscles away. What if you want to have kids? Well, you're not going to be able to pick them up. So he was like, let's talk to Dr. Schneider. There's a much better surgery, and I know that you're a candidate for it. Let's just talk to her. He gave me her cell phone number, and I was able to just call her directly. To me, I couldn't believe that I could just call this really busy Park Avenue surgeon. But she picked up the phone and she talked to me for an hour, and she was really sweet about it, and she asked for some pictures because she was in New York and I was in Florida. She wanted to see if I was a candidate for this surgery. It's called the DIEP flap. And it's basically where they take your belly fat and they use that to make your boobs. But they also harvest blood vessels and nerves so that you can retain some of your sensitivity. It's not nearly as an invasive a surgery, so the recovery is much better. I knew that they were the team for me on that first phone call, just because I wasn't as afraid. But the second I talked to Dr. Schneider, I just felt like so much more relaxed. She talked to me like a human. I just felt like I was talking to somebody one-to-one. I didn't feel immediately in like a doctor-patient situation. She's really kind and she's really warm, but she's also like a hardcore badass surgeon who does stuff that most surgeons don't even know is possible. She's also a world-renowned plastic surgeon, so she was gonna get the opportunity to give me great boobs and a tummy tuck that I didn't necessarily ask for or necessarily need, but like, while we're in there, let's make you look really great. And she actually did say, she said, I'm gonna be the silver lining in your cloud. And she just was wanting me to focus on the fun part, and that she was going to take care of the hard part. And actually, right when we came out of surgery, she was like, you're ready for a bikini. Like, I was still all puffy and everything, but she was right. I looked great. I had a flat stomach for the first time. in my entire life. She told me that there would be no pain when I woke up, and I was like, what do you mean there's gonna be no pain? She was 100% correct. I really had like no pain, and I would just, a week later I was having brunch in New York, and she said, and in our last checkup before I got on a plane, she was like, go home and I want you to go take a swim in the ocean. So that's one of the first things that I did, was just jump in the ocean. She's like, you're healed. It was not what I expected. I was expecting it to be so much harder than it was. I don't have to go get an MRI every 6 months. I don't have to constantly be worried that this scan is going to be the scan. And I'm just so happy that it's over. Not only Dr. Schneider and Dr. Sachs, but the whole team at Silver Lining. They were just the biggest blessing that we could have asked for that year.